It's an old story now, but it still feels like yesterday. When I was a medical resident in AIIMS, New Delhi, there was this patient that was admitted when I was on call. He was a patient coming to us with severe pneumonia, with septic shock and multi-organ dysfunction. Add to that, the patient was already on a ventilator when I first saw him. This was in the evening hours. There was one more problem. The patient was accompanied with his wife, and both the patient and the wife were foreign nationals who could not speak English or communicate with me. So there was a translator who was brought in from the embassy. It was very difficult to communicate about the critical decisions that we had to take. By the evening, the translator also had left, and we were left, me and my colleagues, the residents, fighting to try and save that patient. But the case was difficult. We tried our best, but next day morning, we could not save that patient. I was worried what would be the reaction by the wife now. But when the translator came, you know what? The wife actually thanked us. She thanked us because her husband got the best of the care right till his end. I'm Dr. Sushant Shinde. I'm a physician and medical educator, mentoring medical students for the last 10 years now. As medical students, we sign up for one of the most difficult professions. But if you ask me, the real credit in this story goes to my mentors. All the wonderful teachers that I have met in my lifetime. These mentors, these teachers, they have given me the right set of knowledge, skills and aptitude which lasts for a lifetime. It is learning from mentors like this that we have developed the program at Quest. And for the last 10 years, we have been mentoring students across various cities in India. At Quest, we teach medicine because this is perhaps the most vast and most complex subject in MBBS. But because it is a clinically oriented subject, it gives me the opportunity to mentor students on various aspects of clinical decision making and becoming a clinician. Across the world, medical education has undergone a lot of changes. Medical students across the world today are more energetic, more proactive, well-read and very intelligent. And yet, we see that medical coaching programs in India treat medical students like some exam-going bot who is supposed to just learn and produce results. I think that not only limits the ability of our students to think critically, but really undermines their intelligence. Is there an alternative way? Rather than teaching medical students through recorded monologues or dictating notes in the classrooms, I think it would be much better if teachers and students spend time together to develop the critical thinking that students require for patient management. And flipped classes are one of the best way to do that. Now, what is a flipped class? Think about it. Most of the traditional teaching happens this way, that a student is taught in the classroom and the student goes back in the library or whenever the student is going to revise, and that is the time that she really understands the topic well. In a flipped class, we are going to flip this around. What we are going to do is a student is given a recorded class, a short tutorial to begin with. In that tutorial, everything about the topic, the theory aspect, the facts are explained. The student is supposed to go through that at her leisure. But when the student comes to the classroom and spends time with the teacher, it is this time together that we dig deeper. We try to understand and apply whatever we have learned from these tutorials into real world scenarios. Not only does that make the topic better understood, but it creates a kind of confidence that the student can apply this topic in real world. This is a difference between the traditional model of teaching and the mentoring model of teaching that Quest applies. In the traditional model, it's almost like a pyramid. Well, most of the students are at the base of the pyramid who are expected to learn. Some of these students are expected by their teachers that they will understand the topic, and very few do we expect are going to apply that topic. But at Quest, we don't think that's the best way. We think that all the students that they learn and understand should be towards application based. That means we create a bridge by which students are able to not only learn and understand but apply their knowledge in real world. You can also call this as competency based learning, where the student is able to demonstrate her competence, her ability to perform to herself and to anyone who cares to ask. If you do that, our students are no longer going to be afraid of exams. In fact, they are seeking out opportunities where they can demonstrate whatever they have learned. Through our unique teaching program, with flipped classes, with interactive polls during the classes, student-led case discussions, and with medical simulations, we are training students to develop an holistic approach towards medicine and towards MBBS at large. Visit our website to understand more about our program, and click on the link below to register for a free trial of Quest. I'll see you again. Till then, goodbye and Jai Hind.